For this week's assignment, we were asked to upload a video discussing answers to the question, what keeps you up at night? After reading or watching the John Hopkins videos, I took a little while to kind of sit and think about what keeps me up at night as a nurse. I would say the first thing that I want to talk about is like our mental health patients or drug abuse patients. For some reason, this is something that really keeps me up at night. Thinking about them, feeling for them, wishing that you could just wave a wand and heal whatever's going on with them. In my setting, we try to provide all the resources to them for them to be able to get help. But in the end, it ultimately just falls on deaf ears, usually because they don't have support or strength to follow through and seek out treatment. Another thing that really keeps me up at night is when we get a patient that is incapacitated, living in a nursing home, bedbound, nonverbal, incontinent, G-tube dependent, maybe has like non-healing ulcers, recurrent aspiration pneumonia requiring hospital visits, and the family just wants to continue to keep them alive. For me, it's just something that really stays with me, and I think about these people a lot, just wishing that, they could get, ultimately, that they could just pass in peace so that they didn't have to deal with the day-to-day stuff that they go through. Pretty hard when they can't talk, they can't tell you, but somewhere in there, they probably are still there and they know what's going on. Another thing that keeps me up at night, working in the emergency room, we see a lot of return patients, patients that just come in day after day. Maybe they don't have any serious complaints, but other ones, they're sick every time they come. And, we spend a lot of time taking care of them, kind of healing them or stabilizing them, helping to establish like follow-up care, whether it's like going to dialysis or following up with, a urologist or the oncologist, and we educate them and we provide them all this information, and then they're back in just a few days because they don't have the ability to follow up with everything that they need to, or they just choose not to. So then they're chronically ill and they just keep coming back and back. Another thing that kind of keeps me up at night, but not so much, but definitely came up when I was talking to my coworkers, was staffing and constraints related to that. Working in the emergency room, we can't send people away. We have to treat them. Oftentimes, there's not enough nurses to take care of the patients. There's not enough beds in the department. Lots of times we put patients in the hall, which causes a lot of issues in itself. We don't have enough NCAs to help out nursing tasks such as like collecting swabs, urines, answering call-aids, and just tending to the patient's critical needs. That's something that kind of keeps me up at night, just thinking about, how I could do better, what we could do to improve with short staffing. And that kind of, with that too, what keeps me up at night literally is those call-aids going off in my head. The call-aids, again, with the short staffing, don't get answered as often or as timely, so they're ringing and ringing, and it's really hard trying to provide adequate care to everyone under stressful situations. Working in the ER, you have maybe 4, maybe sometimes 5 patients at a time, some sicker than others. You have to prioritize patients, and sometimes that may mean spending 45 minutes in one room trying to get a line, drawing labs, hanging bags, pushing meds, and trying to stabilize the patient. With that being said, you're unable to attend to your other less critical patients, leaving them sitting in their rooms, listening to what's going on outside and the conversations being had, ultimately wondering if they had been forgotten. I asked a coworker of mine who's worked in the emergency room for over 15 years about what keeps her up at night, and her response to that was much different than most of the ideas that I had came up with, or whatever else my coworkers had kind of said. She mentioned that conversations play over and over in her head about poor leadership in our department and what she would say to management. She mentioned, like, where were you when we were drowning and we needed support? Why was my schedule so messed up? We self-schedule and sometimes things can get flip-flopped around. Or why didn't you allow us to close to transfers when you knew we were unsafe and had no one to give breaks, and none of us had taken breaks? Right now we're going through a lot of change in our department, so poor leadership kind of is a issue that a lot of people are struggling with. And for me, not so much, because we can only do what we can do personally. We can't really control our leadership. So I just try to keep an optimistic mind. And like I said, it's more of the other things above mentioned that keep me up at night.